Welcome back. As we continue off with the conversations this morning, every day nearly 600 more people are diagnosed with leprosy. In 2016 alone, 18,000 girls and boys were diagnosed with leprosy globally, and 39% of the newly diagnosed cases are girls and women. A downward trend in the number of new cases has been observed globally. Thus, the World Health Organization has since 2000 encouraged countries to target elimination of leprosy as a public health threat. Leprosy Day is commemorated on the last Sunday of January worldwide, and this year Namibia will, through media campaigns, host a series of media shows to inform and educate the public about leprosy. This year's event will be commemorated on the 6th of March in the Zambezi region. And to tell us more about this event, we're now joined by Dr. Katri Kalukambe, who is a senior medical officer, as well as Isabel Haingura, who is from the district TB and Leprosy Coordinator, both from the Ministry of Health and Social Services. Dr. Ms. Haingura, a very good morning and thank you so much for joining us.
Thank you very much for having us.
All right. Doctor, if we could perhaps start off with you. I mentioned so much on leprosy, but what exactly is leprosy?
Thank you very much for that. So leprosy is a chronic disease that has been, there for so many years. From 1983, that's when it was actually discovered. So what it is basically, its other name is Hassan disease. So it's just a chronic infectious disease that affects the skin, the peripheral nerve system as well. Also the eyelids and the mucosa, the nasal mucosa. So it's caused by a bacteria called Microbacteria leprae, which is similar to TB, but it's not actually. Usually it's characterized by loss of sensation, skin lesions all over the skin. Leprosy is also a what we call a paucibacillary or multibacillary disease. This just depends on the number of bacteria as well as on the skin lesions that are affected in the body. So basically that's what leprosy is. And it's the mode of transmission is usually through nasal droplets, so nasal discharges. So somebody who has leprosy comes into close contact with nasal discharges or maybe coughs or sneezes. That's how now the transmission mode basically happens.
So it's very much contagious?
It is contagious. It's an infectious disease, but once a patient is on treatment for a week, it doesn't become contagious. And mostly when it comes to physical touch is when there's prolonged touch, but otherwise it's through nasal, it's airborne basically, nasal discharges.
All right. Ms. Haingura, how common is leprosy in Namibia?
It's common mostly in the warmer places, like Kavango. In Kavango, like in my district, it's very common.
All right.
And like this year, my district is the one that reported the highest number in Namibia.
And how many cases are those that were reported?
I reported 14 cases.
Okay.
Yes, so it means we still have leprosy in Namibia.
All right.
Yes.
And this is just from January until now?
December,
From
yes.
December until now?
No, from January 2024 to December 2024.
All right.
Yes.
Doctor, earlier in my intro, I mentioned that 39% of the newly diagnosed cases are mostly girls and women. Why is that the case?
So basically, it doesn't really discriminate when it comes to sex and age, because mostly the mode of transmission remains as through nasal discharges. So it could just mainly be because men have poor seeking health behavior. So you tend for females to be more, they have more awareness, they care more about their health. Men tend to it's just a skin rash, it's nothing more. So you find more of the cases being notified, being females, and of course children because of the care, under the caregivers of females. So it's not really based on the gender, because it does not discriminate. Even from the early age of from 0 to, from adulthood, it doesn't really discriminate. It's just that male are known to have very poor seeking health behavior. So that's why the statistics are leaning more to the female.
All right. You mentioned a rash. What are some of the other signs and symptoms of leprosy?
Yes, that's a very important question. So Commonly, it's the skin rashes, so they can be pale red or just pale, you know. And the classical symptoms of these rashes is that when you touch, you don't feel anything. So there's a reduced sensation. You just think it's a normal rash, right? So they are characteristic, because most of the rashes are actually painful or so, or itching, but this is just like painless. And another thing is that the person will present with loss of eyelashes. So when you see a person with loss of eyelashes, loss of eyebrows, not because of makeup or beauty, but you know, because of that.
Yeah.
And also, you know, the person, there's weakness of the immunity or the hands. You know, the person tried to hold something, but they cannot. And it's also characterized by growth nodules on the skin. You'll just see nodules on the skin. The person will not be able to really close their eyelids, so, you know, because they are weakened. And when they touch something, because it affects the peripheral nerves, they are not able to feel anything. So those are the common signs. So when you see rashes, when you see that your sensations are decreasing, you don't feel anything, you have poor weaknesses of muscles, you know, those are one of the common. You have lesions all over, you know, so those are one of the most common signs of leprosy.
All right. Ms. Haingura, you mentioned your district, which is the Kavango East region, is one of the regions that basically reported a high case of leprosy in Namibia from January last year. Can you just talk to us about the treatment process and also how the 13 patients are doing right now?
Okay, thank you for the question. When they are seen by the doctor, we start them on treatment, and the treatment is for 6 months. So they start their treatment, and sometimes they start already improving. Yes, I wanted to go back to what doctor said about the men and women. So men, mostly when they come, they are already disfigured, like the fingers are already off, the eyes maybe not already closing because of their poor health-seeking behavior. They come always very late. And when they come, they are already disformed. Yeah.
So it causes blindness?
Yes.
Yeah, blindness, disabilities.
Disability,
Yeah.
yes.
Okay.
Yes.
All right.
Yeah.
Why the Kavango East region? Why is it that it is more common in the Kavango East region, or how does it work with leprosy?
So leprosy, basically the bacteria itself, the nature of the bacteria, the climate that it likes warmer regions. So
Yes.
Kavango areas are known to be very warm and humid. So even across the world, you know, places like South Asia, you know, South America, you'll find that it's very prevalent there. But that's just because due to the climate nature and due to the acid-fast nature of the bacteria liking the warmer areas. So basically, in Namibia, those are the areas that are very warm and very humid, and that's why it's very prevalent in the Kavango East, Zambezi, Kavango West, and sometimes, of course, in the north, like Oshana, we do report sporadic cases here and there.
All right. Where can one go and seek assistance when showing some of these symptoms that Dr. just mentioned earlier?
Actually, in Namibia, all our hospitals, all our healthcare workers, the doctors, they have a bit of knowledge about leprosy. And where they can't, they refer to the bigger hospitals where we have dermatologists who can see them and diagnose them and put them on treatment. And those that are already disabled, they refer them to the social workers and the rehabilitation, and then they continue with the services.
Right.
Yes.
But what are some of the efforts that the ministry is doing just in order to create awareness with regards to leprosy?
It's like now we are giving awareness here, and we also have a team on the ground, like currently in Zambezi. Last year they were already in Kavango. So we also go back to the communities to give awareness, even in the radio and local languages also. We give health education, let the community know on how to detect it early and how to help those who are already affected.
All right.
Yes.
Seeing that it's celebrated every last Sunday of the month of January, how is Namibia planning on commemorating Leprosy Day this time around, seeing that January is long gone?
So basically, the main reason why it could not be celebrated on that day, the last day of January, It's just because of administrative, logistic, issues, and because the team wanted to start off with leprosy assessment, site assessment, training of healthcare workers on site, and also just really, because it's characterized by a lot of stigma, especially in the community. Sister mentioned that, sometimes people are disfigured and disability, so, they look at that already as, a very stigma, because in most of communities, it actually, people think when you have leprosy, you are cursed. Or it's a punishment from God. So this is not just coming now, but it has historical background, you can even look in the Bible where leprosy cases were mentioned. So because of that, the ministry, through commemorating, they're trying to really address stigma. So they've been capitalizing, and that's one of the reasons why the build-up activities that, that led the leprosy not to be celebrated January, they felt like there are a lot of, efforts that needed to go before you just commemorate. That is social mobilization, campaigns, and awareness. So that was what was happening prior in January, and just events leading to the World Commemoration Day. So the ministry is going to commemorate it in Zambezi region, as Sister mentioned. The keynote speaker will be the Honorable Minister of Health, Dr. Shangula, whereby with the implementing partners, WHO, and other stakeholders, as well as local authorities, because we believe that they play a very crucial role. Because this is a social issue, it's not just a medical issue. So apart from that, the build-up activities, there will be great local artists as well, performance from local artists, local groups in the region, and so many activities. There will also be ex-leprosy patients who have, who are cured, and also those who are currently on treatment, just to, there'll be a platform of discussions, as well as just motivation, and just to mostly sensitize the community, and just to be kind to one another.
Right.
Yeah.
And when will this day be taking place?
So that's going to be tomorrow,
okay.
The 6th of March.
Are we ready to fly or drive all the way to Katima? Okay, all right. But what are some, but perhaps before we let you go, can you just tell us how many people currently have leprosy in Namibia?
Thank you for the question. Currently, Namibia reported 24.
All right.
Yes, whereby I say that Kavango East is having the higher number. Yes, followed by other regions.
All right.
Yes.
And that's an okay number, right?
Yeah, it's an okay number. I mean, we've reached the WHO target because basically what they want is one case per 10,000 population. So having that already classified as having eliminated leprosy. So for us to report 20 cases, nationally, it just puts us in the status of we are on our way to elimination of leprosy. And of course, we want 0 cases. And that's why we are converting our efforts towards it.
All right. Well, doctor, briefly, before I let you go, it won't be justice for me and the viewers at home. What are your doctor's orders for us this morning?
I think this morning, since we're talking about leprosy, I just want us to, to encourage the message of compassion. I mean, Mother Teresa said, what really kills people, what affects people, it's not the leprosy, but it's the feeling of not being wanted. So, let us be compassionate towards one another. And let us not neglect our health. So if you see a skin lesion or your eyelashes dropping, please, sometimes not always makeup. It could be underlying conditions. So take care of yourself and be safe out there.
All right. Well, Dr. Katri Kalukambe, Ms. Haingura, thank you so much for joining us this morning. All the best with tomorrow's event, and have a safe journey to the Zambezi region.
Thank you so much for having us.
Thank you very much.
All right. Well, that was Dr. Katri Kalukambe, who is a senior medical officer in the Ministry of Health and Social Services, and also Isabel Haingura, who is from the District TB and Leprosy Coordinator, still in the Ministry of Health and Social Services, talking to us about leprosy treatment, care and support, and also the day that will be commemorated tomorrow in the Zambezi region. So if you're finding yourself near the region or in the region, please go out there. Let's learn about leprosy and let's not discriminate. More conversations coming your way. Don't go anywhere.